Hello, this is Dr. Rina Rani Ray. I'll be talking about hospital-associated infections today. Nosocomial infections, also called healthcare-associated or hospital-acquired infections, are infectious diseases that are acquired in a healthcare facility. So here we can see the hospital, and a number of pathogenic organisms may remain present in the environment of hospital. These infections are absent at admission, but can develop at least 48 hours after admission. Often, nosocomial infections are caused by multi-drug resistant pathogens acquired via invasive procedures, excessive or improper antibiotic use. The sources of infection in the hospital are see here the patient is there. So from other patients, from visitors, from hospital personnel, surgical procedures, that is invasive procedures, the air content of the hospital, contaminated water and food, normal flora of the patient itself, then clothes, utensils, then furniture, that is a fomite contamination, and other devices, drains, and catheters. So from so many sources, the infection can come from the hospital. So here we can see from the OPD itself, when the patient is moving to the towards a doctor, it can carry some infections with her, and it may go to the IPD also. The surgical procedure, then staying for long period in hospital, then from invasive devices, then from mechanical ventilation, and from different antibiotics, this type of infections may come, and this will affect mainly the patients who are suffering from immunodeficiency. Now, how do patients acquire infections from hospitals? Patients at the extreme of age, maybe very old age or very young, they are susceptible to this type of opportunistic pathogens, and they are suffering from immunodeficiency of varying degrees. Then patients with diabetic, then cancer patients undergoing chemotherapy, and patients having immunosuppressive drugs, they are really susceptible to different types of opportunistic pathogens, which can really create disaster in them, and they can create nosocomial infection. So what are the most important facts to know about these nosocomial infections? These can lead to the serious problems like sepsis and even death. Most nosocomial infections are preventable with prevention guidelines set by National Public Health Institutes, such as Centers for Disease Control and Prevention. The risk of developing a nosocomial infection partially depends on how strictly healthcare facilities are followed and following the infection control guidelines. Patients at increased risk of infection include those with comorbid conditions, increased age, recent treatment with antibiotics, and prolonged hospitalization. The most common type of nosocomial infection involves invasive devices and procedures like urinary catheters, central lines, mechanical ventilation, or surgery. Nosocomial infection prevention requires healthcare facility-wide adaptation of stringent infection control programs. Yes, stringent infection control programs with ongoing surveillance to identify and control the outbreaks. Surgeons can limit nosocomial infections by implementing protocols that improve surgical techniques, control operating room environment, limit organisms shared by the operating room staff, and decrease length of operation, as well as recognizing underlying patient's factors that may increase the risk of a nosocomial infection. So from other patients, infection may come, which is called the cross-infection. From healthcare personnel, infection may come. from contaminated instruments like surgical equipment, then from contaminated air and water and food, then from inanimate environment of the hospital like bedding and other equipment. So these are called the exogenous sources from which the infection may come. Now regarding the endogenous sources, so we know our body harbors a number of microorganisms as our normal flora. So these flora, many of them may act as an opportunistic pathogen if they get their optimized condition and they form biofilm. So this is the normal skin flora or intestinal flora. They may form biofilm on abiotic surfaces like catheters, then other tubes, then these are the roots of infection in the hospital. So you can see at the catheter, the IV line, these are the abiotic surfaces on which the flora may form biofilm. And these are the endogenous sources. So here we can see the different sources from this infection, which can come in the hospital, like from elevator shaft, then bacteria from other patients, then ventilated ducts, bacteria from outside, bacteria from infected patient, then contamination from equipment, bacteria from visitors, hospital personnel, bacteria carried by the insects, and if the cleanliness is not maintained properly, if the stringent rules are not maintained properly, hospital may act as a potent source for nosocomial infections. So the contamination may come from the hospital personnel in operation theater as well. Now, antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. So antimicrobial resistance occurs when microbes evolve mechanisms that protect them from the effects of antimicrobials. The term antibiotic resistance is a subset of AMR as it applies to bacteria that become resistant to antibiotics. So here we can see the microbes, they are not killed by the drug. The resistant microbes are increasingly difficult to treat, requiring alternative medications or higher doses, which may be more costly or more toxic. So antibiotic resistance is really a headache for the health sectors. Now, how can we protect patients from antibiotic resistant infections? So surgeries and single-use catheters help treat patients, but they can be pathways for bacteria to enter the body. So bacteria can be spread when appropriate infection control actions are not taken. And antibiotics save lives, but poor prescribing practices and rampant uses can put patients at risk. So combine infection control actions with every patient to prevent infections in healthcare. This is the prevent infections from catheters after surgery, prevent bacteria from spreading by washing hands and maintaining cleanliness, and also the doctors are recommended to improve antibiotic use, to prescribe antibiotic only when it is required. Agents that are usually involved in hospital-acquired infections include various bacteria, and these are the Streptococcus, Acinetobacter, Enterococci, Pseudomonas aeruginosa, Staphylococcus aureus, Bacillus cereus, Legionella, then Proteus mirabilis, Klebsiella, E. coli, Serratia, and so on. So major types of nosocomial infections are the infections which are the UTI, that is urinary tract infection, then surgical wound infections, infection in the lower respiratory tract, central nervous system attacking infection, gastrointestinal tract attacking infection, then traumatic wounds causing infection, and primary bacteremia. So here we can see the chart where the major types of nosocomial infections are there. In ICU, we will see this is UTI patients. The number of UTI cases is really remarkable. And in the other area, it is a bit lower. But ICU, we know it's a very, very, very strictly monitored area. Still here we can see the amount of nosocomial infection. So how can we prevent them? So implementing infection control protocols to reduce exogenous and endogenous transmission, minimizing the person-to-person interaction and environmental cross-contamination, practicing hand hygiene, that means hand washing, hand sanitization, proper use of personal protective equipment, avoid unnecessary use of indwelling devices, practicing proper aseptic and sterile techniques during maintenance of devices, appropriate use of antimicrobial with correct dose and duration to minimize the growth of antibiotic resistant pathogens. Surgical site infections can be limited via methods such as regularly disinfecting surfaces, restricting staff entry, minimizing movement of sterile drapes, and appropriate use of surgical attire. Additionally, pre-operative antimicrobial patient bathing and administration of prophylactic antimicrobials. So here are some of the pictures where we can practice some hand sanitization, then cleanliness, and maintaining proper atmosphere. So in this way, we can maintain the hospital atmosphere free from any nosocomial infection. So that is all for today's discussion. Thank you.